Hi folks, Craig here, and welcome to 2023. I use he, him pronouns, and I'm joining today from Wurundjeri country. And I've got a few things to update you on. Let's start with the reform of Victoria's mental health system. So our team, and we're busy collaborating with Department of Health and Safer Care Victoria on key system reform projects. So we're adding the consumer voice to lots of initiatives to make sure consumer wishes and needs are represented. One of the most recent examples of this is the work that's just beginning on access and triage for services around the state. So that's really important work, and VMIAC has been asked to consulted on how we can make sure the consumer voice is heard in that work. Other opportunities have opened up for consumers to share their expertise, and if you're interested in participating, you can do an expression of interest from our website to join our consumer register, where you'll be matched to opportunities where you're paid to use your lived experience expertise. So we're having lots of people bring forward their expertise using our register. So think about that if that might be for you. Now with advocacy, of course, we do individual advocacy here, and that informs our systemic advocacy as well. We've had some wins, but of course, there's much work still to be done to make sure that Victoria's mental health system is safe and a healing place for people who want to access it. Now, related to that is the reforms that are going on to the Better Access program. So the Better Access program is the program where people can access psychological support from psychologists. And you might remember that under COVID, the limit of sessions was changed from 10 to 20. Anyway, there are changes afoot for better access, and we've done some very fast lobbying and advocacy with the other state consumer peaks to see if we can be included in the Better Access Forum in Canberra on Monday, the 30th of January. So I'm really pleased to say that Ali Hodges from Lelan, the South Australia peak, and myself will be attending that forum, and we are going to be advocating for things like the number of sessions that people can access, a tiered service, so where more sessions are available for people who have higher support needs, gap payment. We know that this is a barrier to people accessing using the Better Access program, so we'll be advocating for a lower or no gap payment, and perhaps there will be incentives for practitioners to do that. And we know too that we'll be talking about rural and regional and remote issues, and how just because telehealth exists doesn't mean that telehealth should be the standard that we're aiming for in places outside of Melbourne. And the other one, which is a big one, and you'll see this, some of you will have spoken up in the VMIAC Declaration, which is on our website. It's about types of support as well, because we actually know that not everybody wants to see a psychologist, not everyone wants to see a clinical psychologist, and we know that you've spoken up and said there's other things that you'd like to do, like yoga, mindfulness, and get support from peer workers, people with lived experience. So Ali and I will be advocating for that in the forum on Monday, the 30th of January. And in my update that I have after that, I'll be able to tell you how that goes. Okay. Other stuff that's going on that's really important. Australia has signed the optional protocol to the Convention Against Torture in 2009, ratified that agreement in 2017. Today, the day I'm recording this update for you, January the 20th, 2023, it's the deadline for states and territories to put in place national preventative mechanisms, that's NPMs, to monitor human rights protection in places where people are in detention, including mental health facilities. So I've written, and we've just sent it off today to Victoria's Attorney General to express VMIAC's concern over the lack of action towards establishing Victoria's state prevention mechanism. So let's wait to see what happens there. And we certainly do know that people's rights are breached in Victoria's mental health system. So Australia could possibly be placed on the non-compliance list, which would be deeply embarrassing for Australia. And the UN subcommittee on the prevention of torture actually had to suspend its visits to Australia over these delays or inactions and non-compliance of states and territories. We will continue to have a strong voice on this really important issue. And thank you to those of you we've heard from who have been affected by these issues in mental health services. On a brighter note, we had a celebration this Wednesday for our Consumers Leading in Governance program. So that was a new program that we developed to sort of fill a gap for consumers to gain the skills, to add to their existing skills, to be on boards or committees of management. So we had 2 intakes for that. And we had a lot of in-kind support from facilitators who did sessions for free. And we also had some very generous sponsors as well. We're really looking forward to continuing this training. And we've had interest from Western Australia, from the Victorian government, and also the Family Care Supporter Peak Tandem about future courses. So congratulations to all of the team there who developed that program. And special thanks to Arandhati, Alex, Blossom and Bryony, who brought that together and made it such a successful course. Something else that's going on that you might like to consider is the National Stigma and Discrimination Reduction Strategy online consultation. So that's happening on the 25th of January from 3:30 till 5 p.m. online. We know that many people in Australia experience stigma and discrimination. We know that this prevents people doing some things. We know that it prevents some people from accessing mental health services. So it's a really, really important issue. So if you've seen this stigma, discrimination in your workplace or community, or you've encountered it yourself, add your experience and expertise to this important work that's going on here. So details will be in the link below this video on our website. So also wanted to give you an update on our Disability Royal Commission and NDIS review. So the DRC and the NDIS review team have done great work and submissions to the Disability Royal Commission closed at the end of 2022. That team did an amazing job helping 47 consumers with psychosocial disability from across Victoria make submissions to the Commission. So this is people who otherwise might not have had their voice heard in the Commission. So really, really important work and very important and careful work that was done in the DRC by TJ. And before TJ, we also had Zan working in that area. And this included allowing people from rural and regional communities and also people for whom English was not their first language to make submissions. We're also supporting mental health consumers to make submissions to the NDIS review, so the National Disability Insurance Scheme. So you can have your say in that work, then the details are in the links below this video. So the last thing I wanted to say is that there is a public holiday next week, January 26, and this is known by many people as Invasion Day. So it's just around the corner next week, and we know that this is a day that can be very distressing for our Indigenous communities. VMIAC stands clearly in solidarity with Indigenous communities on this day. And what we're doing for any VMIAC staff attending rallies in their own time, they're able to take 4 hours of time in lieu off on a later day, on another day after the rally. And VMIAC also looks forward to being an ally to the Indigenous community in the lead up to the discussions around the Indigenous voice to Parliament. So that's all for now. Thank you very much for viewing the update, and wishing you the very best wishes and hoping there's still some summer weather left to enjoy, and look forward to talking to you soon.